Okay, so hypertension runs on my paternal side of my family. Would I ever be able to get off high blood pressure medication?
Well, that's a loaded question. Now, for me to answer something like that, I first have to tell you hypertension, what it is, and for you to understand that, then we go into whether it's genetic or not. So the way I would rephrase that question is it hereditary to have hypertension, and am I ever going to get off medications? Number one, hypertension is probably one of the most prevalent disorder you see in the U.S. To start off with, you got to know what is hypertension. Your normal values, you have two numbers. You have the 120/80. The top number is called the systolic blood pressure. The bottom number is called the diastolic blood pressure. So they came up with the 120/80. Now that's kind of what the books say and things like that. Now you have several studies which show the lower the blood pressure, the better it is. So, and you have one a few years ago they said the higher is okay for older people. Some people say no, the lower the better. Bottom line is, in a nutshell, irrespective of what it is, the lower the blood pressure, provided you feel okay, is the best for you, because it puts the least strain on all of your vessels. So the way I try to explain it, like I've written in my blog, as you can see, blood pressure is like the pressure of, let's say, the water in a garden hose, if you're going to water your lawn or something like that. So you can have two sets of garden hoses. You have two homes side by side. One person has the tap opened up pretty high. The other one is just like, not that high, right? So day one, is it really going to matter? No. 5 years down the road, which garden hose is going to wear out first? The one who has that. Why? That's because he's had more pressure going through. So there's more strain on the garden hose inside. So what really happens when you have high blood pressure? So that puts a strain on the garden hose. What happens to the garden hose? Look at it. Forget about arteries for a second. The inside of the garden hose gets cracked with time due to what? Due to wear and tear, arteries bend, going fast, so if you think about it, let's go, the garden hose is not always on like that. The way the heart works is it pumps, relaxes. So it's like that somebody's taking the tap, open, close, open, close. But we can't do a complete closure because the blood pressure never goes to zero. If the blood pressure goes to zero, every time the heart beats, it beats and then it relaxes. If it goes to zero, then we'll be like stroking out every second. It doesn't work that way. That's why we have a baseline diastolic blood pressure of 80, which is like, that's the bottom number. So you have at least, at the bare minimum, a continuous blood pressure at that level. So that's the diastolic blood pressure. The systolic blood pressure is like how much you open the tap more. But we are all born with one type of garden hose, which is the arteries. So the reason I touch base on that is because I want to touch base on both the top number and the bottom number. So you see what the bottom number is? 80, the diastolic blood pressure. Most commonly we see people with systolic blood pressure, right? Elevations. Why? What happens? If you're running, blood pressure goes up because you need more, right? Similarly, if you eat bad stuff, you put on a lot of weight, puts more strain on your body, blood pressure goes up, right? So a lot of external factors, majority of the time, they all cause systolic blood pressure. Very rarely you would ever see, or I've never really seen, just the diastolic blood pressure go up just by exerting. It's not like people running. Guess what? The bottom number went up from 80 to 100, but the top number still stays at 40. It never happens. Not with exertion. So why do I get to that? Okay. Because systolic blood pressure is usually, if you don't find a cause, it's used to be secondary to something else. It could be your lifestyle, it could be what you're doing, what's going on in your body, what your body requires, things like that. In my experience, the diastolic blood pressure being up is usually more genetic, because there's something inherently wrong. Your pressure is always high. You see what I'm saying? The bottom. So it never goes down. So actually diastolic blood pressure is the most underdiagnosed disease process, and that should be more aggressively treated, but we always focus only on the systolic. So diastolic should be less than 90, okay, by all means. There's no questions asked. If anybody has a diastolic of 90 or above, they have hypertension until proven otherwise. You'll never see somebody just say because they had a little extra salt, the diastolic went up. No, it's usually the systolic which goes up with external factors. So in a nutshell, yes, if you have a genetic history of hypertension, if it's genetically transmitted, most likely it's diastolic. Okay. Could you have systolic? Absolutely, because if the systolic blood pressure is due to other secondary issues, like if you have renal artery stenosis, or meaning if you have blockages elsewhere, or if you have atherosclerotic disease all over your body has to respond to it and has to beat harder, so your blood pressure automatically goes up. So there are several factors. There's a laundry list of all the causes of hypertension. So in a nutshell, I think there's a higher likelihood if it's diastolic blood pressure, it will be genetic in etiology compared to systolic. Does that answer? It's a long-winded answer, but it's very hard for me to just focus on that one aspect without giving an intro of what the blood pressure is.